I'm Miriam Sloan from the Runner's Mechanic Physical Therapy Clinic. Today I wanted to show you two types of exercises to do for heel and arch pain. Pain here on the bottom of your arch, extending sometimes down into the heel and lower foot, can be called plantar fasciitis. When the symptoms first start, the symptoms can be very flared up and tender. Okay? In that acute phase, I wanted to show you some exercises that you can do seated. In this position, you don't have the weight of the body on the foot and they're a lot more gentle. They will slowly strengthen you so you can tolerate the harder exercises I show you at the end of the video. Okay? For these purposes, let's pretend that my foot that we're working on today is my right foot. Okay? The first exercise I'm going to show you is called yoga toes. Okay? And what you'll do is make sure that the knee stays in place, the big toe stays down, and you slowly lift the four lesser toes. You slowly lower the four lesser toes, and then, keeping them pressed, raise just the big toe, okay? Slowly you alternate between those, big toe down, four toes up, and then four toes down, big toe up. Usually I'll start between 10 and 20 repetitions. Be sure to keep the knee still. We don't want the knee to actually be the movement that raises the toes off the ground as it goes back and forth, okay? We want the knee still, and we want to make sure the muscles that move the toes are the muscles that control the foot. Big toe up, four toes down, big toe down, four toes up, okay? Then you can get a TheraBand and put a loop at the end. You can get this on Amazon, or any physical therapy clinic should have these. You'll take the loop and you'll put it around the ball of the foot, okay? So first we'll start with the knot on the inside of the foot. Use the other foot to pin it down, and then you can hold this with your hand. In that position, you keep the big toe pressed down and then press the foot to the outside to work the muscles on the lateral part of the ankle. Slowly control the foot coming back in. Keep the big toe down and then press out to the side, and then slowly control coming back in. I like to start between 10 repetitions and working up to 30 as your symptoms allow. Control the movement so that it's slow and you have good control. You then switch the loop so that the knot is on the outside. You switch the leg so that it pins the band down. And from this position, you're going to keep the big toe pressed down and then swipe inwards like a windshield wiper. And slowly relax. Remember to keep the big toe down throughout the movement. If you want, you can always wear socks if that helps the foot glide a little bit better. Big toe down and swipe in. Again, starting with 10 repetitions, working up to 30 as your symptoms allow. And then lastly, you can get a book, anywhere from 1 to 2 inches of thickness, and you place the ball of your foot on it so that it's under your knee. Then you can get a weighted object, whether that's a sack of flour, sand, a medicine ball. You put it on top of your knee, okay? As you get better, you can put more weight on top of the knee. And what you're gonna do is, for a count of 3, 1, 2, 3, you come to the top of that motion, and slowly for a count of 3, you lower the heel down towards the floor so it goes into a gentle stretch. Slowly up, 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 and then slowly down, 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 okay? If you need a little bit more tension, so if you don't feel any kind of discomfort with that, you can get a pillowcase. I've secured it with some hair bands to keep it in a tight roll. And what you do is you block the big toe, you put it right on top of that towel roll, so the ball of your foot is on the book, and the toe is flexed upward and resting on the pillowcase. And then you do the same type of exercise, going up for a count of 3 to the top of your range, and then slowly down, down, down for a count of 3. Up, 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 and down, down, down. Having the towel roll under the big toe really starts to target the plantar fascia. And we're just trying to add strength and resiliency back to that structure. Okay? As your symptoms get better, or as time goes by and you find that you're able to do more and more activities such as hiking or running, but at a certain point you start running into your symptoms. You're most likely ready for a harder exercise. For the plantar fascia, we call this heavy eccentric loading, okay? So you take your roll, all right. What I've done here is I've layered a yoga mat so that it's on top of a book, okay, or a step. And I usually put this right in front of a door jamb, okay? The yoga mat keeps the surface nice and soft with the ball of your foot so it's not painful, and you can hold on to the door jamb for balance, okay? You take your towel roll, right? And we're gonna do the exact same thing. We're gonna put it about 2 inches back from the edge, and that's where the big toes are gonna rest, okay? First start with both toes, okay? So I'm gonna put both toes right on top of the towel roll, okay? I'm holding onto the door jamb for some balance, okay? And the same thing for a count of 3. 1, 2, 3. Come up high onto the toes. And then for a count of 3, lower, lower, lower to the bottom of your range off the step. Up, up, up. For a count of 3, down, down, down. Okay? As your symptoms allow, you can go to a single foot. Okay, same thing, big toe on the towel, up for a count of 3, and then down for a count of 3. Your goal is to get to 3 sets of 15, if you can perform daily. 3, 1, 2, 3, up, 1, 2, 3, down. Ideally, as you get better with this exercise, you will load your body weight with a heavy backpack, so you can put some weights in a backpack, and incrementally load in sets of 5 or 10 pounds. And I would recommend doing this exercise for a couple of months until you feel like your symptoms are well gone. Let me know if you have any questions whatsoever. You can contact me on the webpage, or you can email me, runnersmechanic@gmail.com. Have a great day. Thank you so much.